Hey guys, the picture you're looking at is a picture of Jerome. He was murdered, 42 years old. He was murdered August 9th in Huntington, West Virginia, in Markham Terrace. He was found dead of a gunshot wound inside of his apartment in that complex, and his case is still unsolved. Not too many people are talking about it. The building does have cameras, but it is what it is. I just wanted to take a few minutes to, give remembrance to him and to his family, which probably won't see this, but you guys will. But upon researching what happened to him, I stumbled along a report. And in that report or article, it stated that 26 people had overdosed within 4 hours in Huntington, West Virginia, the Markham Terrace complex. And what they OD'd on was heroin laced with fentanyl. And if you don't know what fentanyl is used for, it's a drug used to treat or relieve pain, excruciating pain that's associated with major sicknesses or illnesses like cancer, possibly MS. It's not used to treat mild pain, slight back pains. It's not used for that. It's only strong, excruciating pain. Some of the side effects from fentanyl are nausea, vomiting, lightheadedness, dizziness, drowsiness, mild irritation, and that's just some. There are a host of precautions when using fentanyl, like if you have a pre-existing condition. You need to, your physician would decide whether this is the correct treatment for you, because it may end up having an adverse effect on your system, like not working or working against what you already have going on, and you don't need that. They use fentanyl, to my understanding, for people like soldiers that are out on the battlefield. They get hurt really bad, and in disasters. You have these earthquakes, and people get caught up under debris, and a lot of times they end up being mangled, legs mangled, fingers mangled. That's an excruciating pain. So that would be another reason to use fentanyl. Okay. What really made me do this video, I was doing some reading, and from the National Institute on Drugs or whatever. I'm going to put it inside the description box because I have a tendency to mess up names sometimes. But they had 2 cases of fentanyl added to cocaine. Okay, so they're moving beyond heroin. We know that they were lacing the heroin with fentanyl, but they're moving beyond that. Okay, so they're moving to cocaine now. And I'm going to put in the description box. It's very detailed, and it gives you the numbers of how many deaths have occurred due to this cocaine laced with fentanyl and heroin laced with fentanyl. And if you guys have any habits, any heroin addicts, or addicted to cocaine, or you like to powder your nose, this is something you really need to pay attention to. Okay, because they have a drug to help you if you OD, but it depends on the potency of the drug you took, and you have no idea. Most of the victims, they have no idea that the drug is laced with fentanyl, nor do they know how much, what the dosage of fentanyl is in that drug. So you may have such a high dosage of fentanyl in your cocaine or heroin that the naloxone, that's what they use to treat it with, it may not even work, and you could just die. So I just wanted to take the time out to do a little video about that. I'm going to snap some footage together to highlight the incident that happened in Markham Terrace. Hopefully I'll be able to find something that highlights what happened in New York. But I'm a New Yorker, and I'm very concerned. We watched the crack epidemic destroy so many people and lives. I grew up in that era, and I see what it did, the devastation that it did to people and families. And the last thing I want to do is see fentanyl come in and wipe us out. You know, everybody wants us in a drug-induced state. You know, our music is filled with poppin' Molly's, Percocets, Lean, Pink and Flocka and all of these things, and they're constantly spewing that type of music out. And we need to make a stand and ask these rappers to stop. You know, stop promoting drugs, because these kids are getting really effed up behind it, and people are dying. Okay, so I'll be right back.
It's an epidemic. I mean, it's beyond epidemic proportions. Al-Qaeda might as well have moved in and taken over. It's that bad.
What we've done for the last 40 years is not working.
This is Huntington, West Virginia. When the war on drugs failed, this town was one of its casualties.
Dispatch to all companies responding. This is going to be a cardiac arrest now. We've got 2 patients. One is not breathing.
Okay, so this is probably not good.
Huntington fire.
They're stabilizing her and getting her in the ambulance.
And a lot of these auto accidents are caused by opioids or drugs.
Well, probably 60% or more of the DUIs are actually heroin and not alcohol.
When the driver told troopers he had an addiction to prescription opioids and that he'd received an injection earlier that day.
Here's how serious the heroin epidemic is in Huntington. While the national overdose rate stands at 13 people in 100,000, West Virginia's rate is almost 3 times that, the highest for any state in the nation. This county's rate doubles that, and the rate for overdose deaths in Huntington itself, about 9 times the national average. On August 15th, the problem came to a head. 28 overdoses in just 4 hours.
We have an unknown problem. So there's people there that are just showing up and dying. I just caught a bit of that. What are people showing up and doing? All they could tell us was that people are showing up and dying.
Nothing would be more effective than for Americans simply to quit using illegal drugs.
Do you think the old drug war failed Huntington?
The drug war failed this country.
Jim Johnson is Huntington's drug czar. He was the chief of police, he ran the jail, and now he has this to say.
If you would have told me, 3 or 4 years ago that I would be a proponent of drug courts and harm reduction programs, syringe exchanges, there was no way that I would have been. I would have thought those were the type of things that enabled. But I've come to understand what enabling is when you know families and people that have had drug problems and you didn't say anything and then you carried their casket. That's enabling.
Today, Huntington is fighting a new kind of drug war, at least new to West Virginia. And it's based on the idea that addiction is a disease to be treated, not just a crime to be punished.
3 days. It's the last time you'll see me.
That's awesome.
Yes, ma'am. Didn't do my first drug until I was 26, and I got a kidney stone here, and they put me on Oxycontin 80s and kept me on them for 9 months for 1 kidney stone. I'm down from using 2 to 3 grams a day to less than half a gram a day.
That's awesome.
I have a master's in culinary arts from UC Berkeley. I have a bachelor's from Marshall University in business management.
And how about a tie?
Yeah, give me a couple of them if you can. Getting clean's easy as hell. That's not an issue. Staying clean is the hard part.
Whether this will work, they don't know yet. But Huntington has already become a model across the state for a more compassionate approach to drug sentencing and drug court.
All right, let's start with Bethana.
Okay. She seems to be remorseful for what she's done. She seems to say, she's sorry. She wants to get back on track. She's having a rough day.
We have a treatment team of people who sit and talk about their cases before drug court to see how they're doing, what we can do to improve their situation.
And while there's been a boom in heroin overdoses in West Virginia, there's also been a boom in places like this. Centers for recovery that work with health and city officials to take a softer approach in treating addiction.
Folks sometimes ask, they'll say, well, hey, how's business? And it's almost a bittersweet moment because yes, we're continuing to expand, but at the same time, you always dream of a day to where these type of services are no longer needed.
A lot of my friends died. I know about 15 of them died from shooting heroin, it's really bad. I don't want to take that chance putting another needle in my arm.
But right now, the heroin epidemic here is not getting better, and Huntington is preparing for even darker days.
This problem is going to still get worse. We have not peaked out yet, and we don't have an answer. We don't have a solution.
We have new information tonight about a rash of overdoses in the tri-state. We now know that 4 people likely overdosed on cocaine laced with fentanyl over the weekend. That's new from Hamilton County's coroner. Those 4 overdosed in Over the Rhine. Medics were called to East McMicken on Saturday evening for 4 people together in a car. 2 of them could not be revived. The other 2 were taken to the hospital.
Warning the public about a deadly new drug trend. It's marijuana laced with fentanyl.
And local authorities are really echoing that warning because it's life or death. They want the public to be aware of this. CBS 42 News reporter James McConaughey spoke with the Shelby County Drug Task Force leaders today, and he's in our newsroom with more. James?
Jim, I was shocked at just how little of the drug fentanyl it would take to do a lot of damage. Lieutenant Clay Hammock gave me a visual demonstration that I really want you to see.
Certainly has the risk of leading to fatal overdoses or fatal consequences.
Fentanyl is a synthetic opioid and has a legitimate medical use in treating chronic pain. But on the street, it only takes a small amount to be fatal. Shelby County Drug Task Force agents have encountered it before, cut with heroin.
This is the same stuff they use as elephant tranquilizers.
But in Tennessee, District Attorney Matthew Stowe told our sister station WKRN that they've recovered marijuana laced with fentanyl.
The bottom line is anyone anywhere could mix fentanyl into marijuana, and there's no way of knowing it until it's too late.
Lieutenant Clay Hammock said it's a disturbing trend because just a small amount of fentanyl can be deadly, even to the touch. He used a packet of artificial sweetener to illustrate his point. There's about a gram of powder in the packet.
Just a small amount in the hand right there is more than enough to be a fatal dose of fentanyl. If we were to empty the entire contents of this sweetener, artificial sweetener packet into our hand, 1 gram arguably is enough to wipe out half a gymnasium, if not more, of individuals of fatal doses of fentanyl.
It's even changed the way narcotics investigators are responding to calls.
We spent the summer sending our investigators to level A hazmat schools to become certified not just to respond, but also to handle and package this evidence.
Hammock said so far they have not seen any marijuana laced with fentanyl in Alabama, but he said when trends like this evolve in neighboring states, it certainly gets their attention, and the public needs to be aware. Live in the newsroom, James McConaughey, CBS 42 News. Local coverage you can count on.
Agents made a record fentanyl bust in New York and seized enough fentanyl to kill 32 million people, police said Tuesday. Officers seized nearly 270 pounds of fentanyl, heroin, and cocaine worth $30 million during separate busts, KTLA sister station Hicks reported. Authorities also arrested 4 people. The sheer volume of fentanyl pouring into the city is shocking, said Special Narcotics Prosecutor Bridget G. Brennan. Investigators first recovered more than 140 pounds of fentanyl during a raid on a Queens apartment, along with nearly 59 pounds of fentanyl mixed with other narcotics. A fentanyl dose weighing just 2 to 3 milligrams can be deadly. The amount of pure fentanyl seized could have yielded approximately 32 million lethal doses. Police arrested Rogelio Alvarado Robles and Blanca Flores Solis in that bust. Investigators also recovered 55 pounds of fentanyl and heroin in a September seizure in the Bronx. They took 2 people, Edwin Guzman, 35, and Manuel Rivera Santana, 32, into custody. Fentanyl is approximately 50 times stronger than heroin and is increasingly found mixed into the illicit narcotics supply in New York City. The drug is driving a spike in fatal overdoses. The number of fatal overdoses far outpaces the number of homicides in Queens. District Attorney Richard Brown said, "We are facing a new and increasingly deadly crisis in our communities," Brown said. These two investigations that led to the seizure of these drugs will undoubtedly save lives, and we will continue to work diligently with our law enforcement partners to combat this growing epidemic.